Huli nga po tayong nakapagtala ng higit 5,000 cases nung humingi ng time out ang mga medical workers. Agosto pa noong nakarang taon. Para bigyan linaw ang mga usaping ito, makakapanayam natin si Professor Butch Ong mula sa UP OCTA Research Team. Welcome back, Prof.
Yes, magandang umaga, Secretary, and I'm glad to be back here.
It's nice to have you again, sir. Paano nasabi ng OCTA Research na ang pagtaas ng daily recorded cases ng COVID-19 ay posibleng dahil sa mga bagong variants ng coronavirus na natagpuan na sa bansa?
Kukumpara lang natin sa last year, no? Kung nasabi niyo na kanina, around the end of July last 2020, the medical health workers asked for a 2-week timeout. No, at that time, that was the old variant. No, now that the new two variants are in the Philippines, the UK variant and the South African variant, nakita natin na mas mataas ang surge ng new cases ngayon kaysa last year sa July, no? Ibig sabihin, yung pagtaas ng cases natin mas rapid kaysa sa last year. That's why we are saying na ngayon, no, yung ating reproduction number 1.66 ay malapit na rin dun sa reproduction number nung time ng August last year. So ito po yung mungkahi ng ng research team namin na gumawa ng localized response yung mga LGUs, no, kasi may na-identify din kami mga high risk areas na nabanggit na kanina, no, Pasay, Makati, Malabon, Navotas. These are areas na medyo tumataas na yung number of cases. So mungkahi ngayon is to be very vigilant, no, still perform the minimum health standards. Kahit na bago mga variants sa ito, ganun pa rin naman ang dapat gawin, no? The minimum health standards, masks, physical distancing, washing of hands, no? Ito po ay it will still work with these new variants. Pero ngayon, ang UK at yung South African variant, alam na natin base sa pag-aaral ng ibang bansa na mas nakakahawa ito. No, ito ay more rapidly spreading than the previous ones.
Ang ibig bang sabihin nito ay posibleng mas marami pa ang kaso ng UK and South African variant sa bansa more than what has been discovered so far?
It is possible, Secretary, na mas mataas pa than what we know now, no? Kaya sinasabi namin na sana mas mabilis pa at mas efficient pa yung genome sequencing ng ating mga test, no? Kasi kailangan malaman natin talaga kung ilan yung mga number of new variants na nag-circulate sa ating bansa, no? Because this will give us an idea on how fast it will really climb, no, yung mga new cases. So key dito or susi dito ay yung pag-analyze at sabihin natin to identify which areas have these new variants. So it is possible na mas mataas pa talaga yung number than we previously thought.
Sa mga bagong COVID cases na naitatala ngayon, many experts are noting na may family clustering na raw na nagaganap kung saan buong pamilya ang nagpo-positibo sa COVID-19. Ang ilang syudad, gaya ng Malabon, ay hindi na pinapayagan ang home quarantine. Dahil dito, pwede po ba natin ipaliwanag ano itong family clustering of cases at mas mahirap po ba itong sugpuin?
Okay, ang family clustering ay ibig sabihin may local transmission na sa community natin, sa barangay natin, no? Or ibig sabihin dumadami na yung buong yung mga pamilya na ang nahahawa rather than individuals na nahahawa, no? And before kasi nakita din natin even with last year's variant, no? Nag-uumpisa na ang family clustering. Pero ngayong variant na ito, even sa mga pasyente ko, mas marami na akong mga kilala ngayon na buong pamilya ang infected. Now, another angle to this is that children are also now infected more now than before, no? Dati kasi yung mga bata seemingly konti lang ang kaso ng mga pediatric cases na may COVID-19, no? Pero ngayon mas dumadami na rin tayo nakikita mga children who are also infected with COVID, no? And this is possibly why the reports now say that there is family clustering, no? Because hindi lang yung mga adults or yung mga elderly ang natatamaan, meron na rin tayo mga cases of pediatric or with children, no, being infected with COVID.
Can you briefly explain to us the situation sa mga lugar na na-classify nyo as high-risk areas dito sa NCR, gaya ng Pasay, Makati, Malabon, and Navotas? Kamusta ba ang trend sa mga lungsod na ito kung ikukumpara nung mga nakaraang buwan?
Well, sa ngayon yung mga kaso natin na like sa Pasay, sa Quezon City, sa Malabon, no, mataas pa rin talaga yung kanilang positivity rate. Quezon City's positivity rate is at 8%, no? Ang Makati at 10%, Pasig 9%, let's see, Navotas is now at 8%, no? Ang Pasay is at 6%. Ang ibig sabihin nito ay for every 10% tested, no? Every 100 tested, no? 10 are found positive. So ito ang rate ngayon, no? Yung attack rate din medyo mataas din per area. Ibig sabihin may clustering din per LGU. Ang take home message ito ay the community transmission is really quite high in NCR, no? Maaring nakuha ito sa mga areas na sa may mass gathering like palengke or sa mga malls, no, na dinadala sa bahay, no? At pagdating sa bahay, talaga mas dumadami na rin sa barangay nila, sa mga communities nila. So in those areas, mataas pa rin, no? Hindi sila bumababa. Pero meron tayong nakikitang mga area na baba, no? Nakita natin yung Malabon and Navotas. Ang trends are slowly going down, no? Slowly, but they're still quite high, no? In the other areas outside NCR, Cebu City, Lapu-Lapu City, Mandaue are now on a downtrend, no? Davao has seen decrease in a number of cases, no? But Baguio, pataas ang Baguio, no? May konting uptrend siya sa daily new case nila. So meron tayong mga communities na pababa, may communities tayo na pataas, but in general, no, there is really an uptick of new cases sa NCR in general and sa buong Pilipinas.
Sa palagay nyo ba ay sapat pa rin ang ginagawang localized lockdown sa mga barangay lamang o household para i-mitigate ang pagkalat ng virus o mas mainam kung gawing citywide o district-wide na ito?
Yes, Secretary, no? Kaya kami naglalabas sa mga data na per barangay and per area, per municipality kasi naniniwala kami na pwedeng or magiging effective din naman ang mga localized na community movement restrictions, no? Ibig sabihin, pwede naman sa sa syudad lamang or sa barangay lamang, no? Kapag ito ay let's say na home quarantine na sila or na-restrict ang movement sa mga local governments na ito, maaring bumaba talaga ang number of new cases, lalo na pag sa transmission ng intercity or intermunicipality, no? So let's say one city has a high number, yung katabi niya mababa, no, to restrict the movement to the ones lower cases, no, will be effective kapag localized ang kanilang restriction ng movements.
Tama po ba na mas mabilis pa raw ang surge in infections ngayon kaysa July and August last year kung kailan binalik noon ng Pangulo ang Metro Manila sa MECQ as requested by medical workers na humingi ng timeout?
Yes, Secretary, that is correct, no. Ayon sa mathematical modeling namin sa research, sa OCTA Research, no, mas mabilis ang pagkalat ngayon ng COVID than last year nung humingi tayo ng 2-week timeout ng July to August, no. Although the numbers are not equal, no. I think dati nasa 4,000 per day, no, ang tinatalang number of new cases last year, no. Nag-uumpisa pa lang tayo, and this is the best time actually for us to strictly adhere now to the standards, for the LGUs to review their trends in their cases and to do their localized community response. Ngayon dapat, para hindi na natin makamit yung dating napakaraming number of new cases per day.
May pag-aaral po ba kayo sa kung kailan naman naabot sa critical level ang ating mga health facilities kung magiging ganito ang figures natin sa mga susunod na araw o linggo?
Sa ngayon, Secretary, nakikita natin yung current lang na data, no? Yung hospital occupancy is set at 75%, no? As the alarm level, no? So nakikita ko nandito sa ano natin, no? Makati has a 93% hospital utilization. Lapu-Lapu 73% hospital utilization. Ito ay mataas na po ang ano nila, na napupuno na po yung hospital nila at na-strain na yung healthcare workers, no. Now the other areas or municipalities in the mga syudad na nakikita natin, medyo nasa 40-50% yung kanilang hospital utilization. Slowly it is climbing, no. And well, that is still good news, no, na medyo gumanda ang ating hospital capacity for the last several months, no. Dinamihan na natin ang COVID wards, dinamihan na yung beds which are allotted for COVID, no. But now we see the two new variants in the country, no, the UK and the South African variant. No, we are afraid that even though we have increased our hospital capacities in the last few months, no, it might soon be overwhelmed by the number of new cases which are coming in due to these new variants.
Does it mean mainam na ibalik muli sa MECQ ang Metro Manila to curb the cases just like what we did last year?
Well, Secretary, it's still early to tell. However, yun nga naman, no, the earlier we act, the better. We can only base our decisions on what we have learned in the past and what we are seeing now, no. Ngayon kasi we are experiencing, despite a lot of new cases, no, gumaganda na yung hospital capacity. Although nakikita natin sa mga balita ngayon na napupuno na yung mga ospital natin. So the recommendation is still that we believe that localized, no, targeted lockdowns, no, can prevent super spreader events, no. So yung LGUs can perform their localized community response against the spread of this disease, no. But still, no, yung implementation ng MECQ or ECQ as before, no, pag-aaralan dapat yan, no, based still on the data we have on the local government level, no. So right now there are areas in NCR na mataas, areas na mababa, and we still have to study also the mobility of the people, no, kung saan nag-criss-cross o kung saan nag-cross ng borders yung mga tao from a municipality with high number to a municipality with low number. So sa ngayon, ang recommendation ng OCTA Research Team ay implement more effective localized border control, no. So kung meron tayong dapat na mas vigilant or mas magandang implementation, it is today, no. So kailangan na nakikita natin yung mga tao properly worn ang kanilang mga face mask, no. Kapag papasok sa mga establishmento, dapat yung minimum number or maximum number pala of people in the establishment is very well controlled, no. 50% or even less is better, no. Papasok ka sa restaurant, dapat ma-implement at ma-enforce dapat yung number of people occupying the establishment, especially in the workplace. Hindi natin pwede munang payagan na medyo mataas ang 100% occupancy ng facilities, no. So these things, no, to improve further our minimum health standards, improve the implementation, improve the monitoring, and let's just say localized community controls na lang, no. So yan ang mungkahi ng OCTA Research Team sa ngayon.
Ang worst case scenario na nakikita ninyong posibleng mangyari base sa current trends ng COVID-19 cases bago magsimula ang mass vaccination na ayon kay Sec Galvez ay pwede sa third quarter pa ng 2021.
Well, Secretary, the worst case scenario really is by the end of March is the worst, no? That scenario, we will have about 5,000 to 6,000 new cases per day in the country by the end of March. No? Kung hindi natin pagagandahin yung ating minimum health standards, yung pag-implement pala ng ating minimum health standards. So right now we are seeing 3,000 cases per day. I had hoped that yung 3,000 cases per day last week ay bumaba sana ulit sa 1,000 or 2,000, pero nag-maintain siya sa 3,000. No? We are afraid that the country is projected to have a 5,000 to 6,000 cases by the end of, that's per day, no? By the end of March. So sana ngayon tayo mag-act and to perhaps to strengthen pa the vaccination program and to assure the people that the vaccines which are approved by the government, vaccines which are given the UA are safe and they are all effective. No, whatever brand they are, kapag dumating sa inyo ang vaccines, please take the vaccine to protect not only yourselves but to protect your community, to protect your family. No, the best vaccine is the vaccine available to you at that time. No, so narinig natin kanina na yung may bagong mga stocks tayo na parating o dumating na galing sa AstraZeneca. These are also effective. No, yung Sinovac na nauna nang na binigay, this is also effective in combating COVID-19.
Meron po bang data or projection na rin ba kayo kung gaano makakabawas o makakatulong ang pagpapabakuna sa transmission rates natin sa bansa?
Sa ngayon, Secretary, we will be perhaps doing that portion of the research later on. We still don't know the trending from the last vaccination program. Pero these were done in sa hospital care workers, no? Yung unang rollout ng vaccination. So wala pa kaming trending on how the community will react, no? Kumbaga, how soon the numbers will go down, how soon we will all go back to normal. Wala pa tayong data sa ngayon, Secretary.
Punta naman natin ang mga tanong mula sa media with Yusek Rocky.
Yes, good morning po, Professor Ong. Tanong po ni Evelyn Quiroz ng Filipino Mirror, many local governments daw po have decided to drop the swab test requirement for visitors entering their localities. The OCTA Research Group believes that local governments must still impose the testing requirement for tourists. What measures can OCTA adopt in order to make the government listen to their advice?
Well, Undersecretary, nabanggit ko kanina that one of the risks or hazards pala of COVID transmission is mobility of the people from area of higher number of cases to an area na mas mababa ang number of cases. No? So, how can we determine kung ang papasok ng mga bisita or yung mga tourists na will enter the LGU is positive or not? No? So, kailangan, I believe na kailangan pa rin natin na magkaroon pa ng testing. No? Although, I understand that the LGUs have, kumbaga, they can implement their own protocols, no? But we still believe that we should know the actual situation at this time kung yung mga bibisita sa ating mga municipalities and cities at syudad, no, ay negative talaga, because we want to curb or to stop the transmission of these new variants which are very much highly transmissible. So ngayon ang mungkahi pa rin namin is to convince the LGUs that testing should still be done for visitors coming into their region or municipality.
Advice, please, para sa ating mga kababayan at lalo na sa mga LGU na nabanggit po ng inyong grupo bilang high-risk areas. Please go ahead, sir.
Thank you, Secretary. Para sa ating mga kababayan, no, may pag-asa pa, no. Tayo ay meron ng mga vaccine sa parating. At alam naman natin kung ano ang tama natin gawin, no? Yung apat dapat na sinasabi ng Department of Health na matagal na, no? Yung pagsuot ng mask, ang pag-perform ng physical distancing, paghugas ng kamay, at pag-minimize sa mga areas na maraming tao or crowded places, no? Kung magawa natin to, we can do it as a nation, no? We can fight COVID together, and with this game changer, which are the vaccines, no? Maaari natin makita na pababa sana ang ating mga number of cases very soon, no? So konting disiplina lang sa ating mga sarili, and please study what the vaccines can do for you, for your family, and for your community, no? We need to protect each other, we need to protect our families, no? And to do this, madali lang, no? Yung disiplina ng ating mga sarili sa pag-perform ng minimum health standards, at yung pag-aaral, at sabihin lang natin ay sana magkaroon kayo ng opportunity to be vaccinated as soon as possible, no? And when the vaccine comes to you, ang sinasabi namin, the best vaccine is a vaccine available to you at that time, at the time it arrives in your community. And I would like to assure them, the public, that whatever vaccine or vaccine brand that the government has studied and has given EUA, no, it is safe and it is effective. And I hope that we see the end of this pandemic very soon, so we can all go back to our new normal. Maraming salamat po.
Maraming salamat sa pagpapaunlak, Professor Butch Ong ng UP OCTA Research Team. Mabuhay po kayo.
Salamat po at magandang umaga sa lahat.